to Facts, Family, and Fall Wellness, the importance of vaccination. I'd like to also say that if you have questions, please add them to the chat during the talk. We'll try to get all the questions answered. And also, this webinar is being recorded. We're being hosted by a partnership with CVEEP and with Your Vaccination Guide. And I'll tell you a little bit about Your Vaccination Guide. We started Your Vaccination Guide through the California Chronic Care Coalition right when COVID broke out. What we realized at that time is that people were getting a lot of misinformation, and especially people with chronic conditions. There were so many questions that needed to be answered. So we decided to put up a website, which became Your Vaccination Guide, which is still standing and still trying to keep everything updated with all the changes in the vaccine. If you don't know who the California Chronic Care Coalition, we're a unique alliance of more than 30 consumer health organizations and provider groups that promote the collaborative work of policymakers, industry leaders, providers, and consumers to improve the health of Californians with chronic conditions. Just a little bit of background and some of the things that we'll be talking about today. Routine vaccines rate for kindergarten children continue to decline. Exemptions from school vaccination requirements, particularly non-medical exemptions, have increased, and recent trends appear to be related to increasing vaccine hesitancy, fueled in part by vaccine misinformation. So we're going to hit this head on. We have two powerhouse experts in the field on vaccines that have worked on this a whole lot longer than we have, and I'm going to introduce them. First, I'm super excited to have Dr. Richard Pan. Dr. Pan is the former California State Assembly member and senator. We started working with Dr. Pan years ago on lots of different issues for people with chronic conditions. And then we held, before COVID came out, a in-person meeting, and it was just, I know you remember, Dr. Pan, we're just hearing something, that something was happening. There was no name and not to worry about it, right? So Dr. Pan has been a real hero in authoring many important pieces of laws requiring safe and effective childhood vaccines for all California children attending school, which is why he was named Hero of Vaccine History by Time Magazine in 2015. SB 277 was 2015, which eliminated the personal belief exemption for school required vaccines, and SB 276 in 2019, which helps track and verify the legitimacy of medical exemptions for school required vaccines. And then I want to also introduce you, because we're going to do this more as a fireside chat. I want to also introduce you to my friend Janet McUlsky, which we have worked way before the vaccine issue, again, on chronic conditions, but she's a nationally recognized expert in stakeholder alliance development with extensive experience in strategic communications and working with healthcare advocates across the U.S. She worked as senior director at Pfizer, focusing on developing long-term partnerships with nonprofit patient advocacy organizations, and Janet created impactful programs like the Pfizer Health Advocate Leaders Breakfast Series. Drawing on her 2 decades of experience, Janet founded McUlsky Health Force, I love that name, in 2020, a consulting firm dedicated to helping organizations build meaningful alliances and amplify their voices in the healthcare space. One of Janet's focus areas is vaccine education and access. She runs CVEEP, which we are a partner of, California Chronic Care Coalition is a partner of, and is one of our hosting members for today. Her coalition building work helps bridge scientific, patient, and policy perspectives on immunization and access to care. So I'd like to welcome both of you here today. I'm going to stop sharing the PowerPoint and bring you in. And Dr. Pan, welcome. Janet, welcome. Do you want to
You-
start, Dr. Pan, with just telling a little bit about yourself and
Sure.
the excitement that you have going on in your life right now?
Well, thank you, Liz, for that wonderful introduction. I'm Dr. Richard Pan. I'm a pediatrician here in Sacramento, California. I've was previously faculty member at UC Davis in pediatrics, where I ran the training program before I ran for the state legislature in 2010. Um, and in the state legislature, I'd served actually for 12 years, 4 years in the state assembly, and then 8 years in the state senate, working to really try to be sure people get better access to health care. We actually reduced the number of uninsured people in California by over two-thirds during my time in the legislature. We also worked to make healthcare more affordable. Uh, Admittedly, when I ran, my initial intention was not to try to address vaccinations, but we had several outbreaks of vaccine preventable diseases during my time in the state legislature. Actually, right before I got elected, we had a terrible pertussis outbreak that actually killed, I think, 9 infants, infected almost 1,000 infants, many of who had to be hospitalized. And in fact, the legislature, this was before I got into the legislature, responded by requiring pertussis or whooping cough vaccines for middle school kids to be sure that they were still immune and could not transmit this bacteria to their infant siblings, right? And so that was one of the ways we tried to reduce the spread of those diseases. And then in 2015, we had a measles outbreak in Disneyland. Uh, at that time, it was considered a large outbreak. It actually infected over 100 people. Unfortunately, now we're at a 30-year high of measles, so 100 seems like a very small number compared to how many cases we have now. But uh, uh, actually no one should actually get measles in the United States. And so that's when at the request of many parents who said, why should I have to worry about my child, particularly my infants, because infants under a year of age are not cannot be vaccinated yet, basically to be exposed and potentially infected by this very serious and often sometimes deadly disease. And that's why I ended up authoring SB 277 to increase our vaccination rate so that was high enough to provide what I call community immunity. And that is a really important aspect of vaccinations because it's not only how effective vaccines are at protecting yourself, it's how effective vaccinations are in protecting people in the community who actually cannot be vaccinated themselves. They may have an autoimmune problem. They may have an immune suppression problem because they're being treated for cancer, or they have a transplant, or they may have a autoimmune disease, a rheumatoid disease, and those are types of things that actually would make a vaccine less effective in those patients, and they would not necessarily be protected. So they rely on the rest of us to be protected. And of course, we talk about infants. When we talk about measles, we don't give the MMR vaccine before a year of age. And there's several reasons for that, but I won't get into them right now. But that means you have all these babies who are particularly vulnerable. In fact, one of the parents of a child who was infected at Disneyland helped support the passage of this bill. And so, uh, so this is really what we want to try to be sure we address is the protection of our community. And frankly, that's one of the most fundamental roles of government is to be sure we protect our community from serious diseases. I will make mention that since I left the legislature in 2022, I'm back teaching at UC Davis, actually public health of all things, and really excited to again engage in a further discussion about not only the facts around vaccines, but also vaccinations are so important for all of us to be and to ensure that we keep our community safe. Thank you.
Thank you, Dr. Pan. And welcome, Janet. Do you want to give us a little background and some of your thoughts before we get started?
Sure. Thank you, Liz. Thank you, Dr. Pan. I'm inspired. I have to say, I retired from Pfizer in May of 2020. If that timing sounds reminiscent of what was going on in the world, it was really when the world shut down. My husband and I had planned that we were going to travel the world in retirement, except the world shut down. And Pfizer called and said, we need help. We need help helping people understand what's going on with regard to the development of vaccines, how they're being done, the whole concept of mRNA vaccines, what that meant, how that worked. really the broad range of what was happening, to try to develop a preventative vaccine to protect people against COVID. Having two parents at the time who were very seriously immune compromised, one with cancer and one with Parkinson's, both in their 90s, it was something that it was very clearly important to my family personally. So I said, okay, I won't retire. We'll start working on this. And we started talking to advocacy communities, whether they be patient advocates or business advocates. Because if you remember at the time, the world, I mean, the Restaurant Association, the restaurants, everybody was struggling terribly. And so we built a group called, it was then CVEEPs, COVID Vaccine Education and Equity Project. We've now actually changed the name to the Champions for Vaccine Education and Equity because we realize it is so much more than just a COVID vaccine. It's all the vaccines that are being questioned and challenged and need more education. And so we have 280 organizational members of CVIP, including everything from, I mean, just who joined this week was the Menopause Society, because they were, there are a lot of women. We were actually talking about the pneumonia vaccine, and that's the approval. The insurance companies now will fully fund it from age 50 and up rather than 65 and up. And when I was talking to Claire Gill, the head of the Menopause Society, she said, I had no idea they'd done that. And so we said, okay, again, it's a matter of providing information and education to people so they can make informed decisions. So for the last 5.5 years, that's what we've done. We've worked with groups, including 5 of the Olympic teams, who were very interested and concerned about wanting to make sure that their communities understood how to make informed decisions. And particularly within communities that are maybe a little bit less educated, informed, and have less access. And so we were traveling around hosting educational events at many of the competitions to choose the Olympic teams, which was extremely rewarding because you felt like you were really helping people. They don't just read these silly things that are misinformation that's out there, but they get really science-based facts that can help them make decisions. And so that's really what CVIP is about, is trying to provide information so that people can make educated decisions for themselves. I will tell you, just going back to my parents, my father was 91, had cancer, and had been on his immune therapy throughout all of COVID, did very well, made us promise that if he got COVID, we wouldn't take him to the hospital because he didn't want to die by himself alone in the hospital. And so we said, I'm lucky I have 3 brothers, and there are 4 of us then that could be involved in taking care of him. So we got it. At the very end of 4 years, he finally ended up getting COVID after being vaccinated, but because his immune system was so compromised at that point, and he died about a month later of COVID. So when people say, oh, you don't really die of COVID, it's all a little bit of hysteria, I'm here to tell you, you do. And he had lived a good life, a happy life, and died with his family all around him. All of us with our masks on, but it's something that we'd hear about daily. I was sharing with Liz. I think I was sharing with you, Liz. I'm losing track who I was telling. One of my colleagues has a 8-year-old nephew who is hospitalized right now with COVID. So when you talk about children, he had not gotten vaccinated because all of this swirl about whether children should get vaccinated, and the parents had not vaccinated him. He's now in the hospital and has sepsis as a result of the COVID. And so it's so hard for people to know what to believe, what trust, where is their real science. And I know I really enjoyed talking to Dr. Pan yesterday a little bit because the only science I have is I'm a poli-sci major. Okay. That's the only science I have. That doesn't really help me make decisions on vaccines. So I really appreciated so much of what Dr. Pan shared with us on a pre-call yesterday. And I know he'd like to share more of that now. So thank you, Liz.
Thank you. Thank you so much. I'm so honored to have both of you here. you've been working in this area for so long, and hopefully today will help some people who had questions. And this is being recorded, so it'll be shared with a lot of other people. We'll get it out on social media because the misinformation, I think, is probably one of the dominating issues that have really affected. I'm a baby boomer, and I came out of the polio area. Uh, Not the polio area, but the that time
Era. Yeah.
era, yes. And I remember I was in kindergarten, and I remember us lining up. We lined up around the blocks to get that sugar cube to stop us from getting polio. Nobody was afraid of getting the vaccine. Everybody was so excited because polio was landing people in iron lungs. And then to work on the eradication of polio and then the other vaccines. So we came in, I grew up in an era where we didn't have a lot of vaccines. And so people got really sick. Some people died. Some people lost their hearing. Some people became sterile. Some people, there were so many things that happened at that time. So we never thought twice that when there was a vaccine that came out that we wouldn't get it or our parents wouldn't take us to get it. So I guess maybe that's some of the where we can start. And I'm really glad you called attention to what Dr. Pan was saying yesterday because one of the things you were talking about was shingles.
Mm-hmm.
And
Right.
maybe we could just start there and then we'll just kind of work through that.
Yeah. Well, first of all, oftentimes people opposed to vaccines will say there's so many vaccines and there's always more coming. I said, isn't that great? Right? Because isn't the best thing to have something that will prevent you from getting the disease in the first place? Right? Now, not all vaccines exactly do that. For example, the flu and COVID vaccine, what they do is that they make it less likely that you'll end up in the hospital and become very sick for that. Right. So if you're playing people say, oh, I got my flu vaccine, I still got the flu. Um, Actually, the flu vaccine does prevent a large number of people from getting the flu, but what it does for even more people is that if you do get the flu, it's a much milder illness than if you didn't have the vaccine. You're much less likely to end up in the hospital. We see the same with COVID. So just because it didn't stop you from actually getting the infection, it still kept you from necessarily getting the hospital or even dying, frankly, as well. And we see that death rates from COVID and flu are very closely associated with lower, when they're basically with the vaccination rate. So the higher vaccination rate, the less likely people are to be hospitalized or to die from these diseases, even if they're not entirely prevented. But let's talk about shingles because, first of all, well, hopefully we're going to see less shingles because we're now routinely vaccinating all children from chickenpox. So shingles is a result of the chickenpox, catching the chickenpox. If you're chickenpox after you catch it, doesn't go away, right? So you think it's gone away. It hides out in the nervous system in your body. So if you really study it, the little virus hides out in the nervous system. And then when you get older, it travels along that nerve and pops out, right? And in fact, there's a very classic appearance of shingles where basically you'll see you have a bunch of blisters that look like chickenpox along a strip on your body, right? That's because it went along that nervous system. And it's extremely painful. Talk to anyone who's had shingles. It hurts. Right. Yeah. Because it stimulates that nerve. And people feel, in a lot of pain and very sick with this. And so by preventing someone from being infected with chickenpox, we can prevent shingles. Now, for all of us like myself, who was born before the chickenpox vaccine, getting the shingles vaccine will help, even though that little virus is hiding out because I got chickenpox way back when before there was a vaccine, and it's hiding out my nervous system. Shingles vaccine is going to be sure that my immune system is ready to nail that virus when it tries to pop out, right, and prevent me from getting shingles. And so, again, isn't it amazing we have something that can help prevent something that's so painful and so from happening to us. The other thing I should also mention is that an added benefit of the shingles vaccine is that apparently getting the shingles vaccine is also associated with reduced rates of Alzheimer's disease. So if you're worried about getting Alzheimer's, Well, get the shingles vaccine because it won't eliminate it, but it decreases that chance. So these are the types of benefits people oftentimes are not aware of. But certainly there are plenty of people out there trying to scare people. Oh, it's a vaccine. It has these toxins and stuff in there. But actually, vaccines go through a very rigorous process of safety to be sure that they're safe and that, in fact, only takes a small amount of trouble for us to actually remove a vaccine from the market. One example I want to give is that when the rotavirus vaccine, which is a virus that causes diarrhea in children, was first invented, we had a few extra cases of a bowel obstruction that happened. Now, bowel obstruction is serious, so I don't want to diminish that. And that vaccine was actually removed from the market. It wasn't just like, oh, well, we'll give it to fewer people. We're just going to say, take it off the market until you fix it. And they did. And now it's back on the market and doesn't have that problem anymore. So I want to assure you that vaccines are very carefully studied, not only for their approval, but even after they're approved, more so than any other medication to ensure it's safe. And if there's actually any real data to show that it's unsafe, very often it will be pulled off the market until that is particularly addressed. So I think we should all be confident that vaccines are safe as well as effective. In fact, I point out that, as a father, as a parent, I've ensured that my children are fully vaccinated according to the recommended schedule. And I myself get the adult vaccines as recommended, including the shingles vaccine. I got my 2 doses because I want to benefit from that, from those benefits. So hopefully that also gives you confidence that when you make your own personal decision, it is your personal decision, that looking at the accurate information, that people who actually study this and have often made the kind of decision that perhaps you want to make as well. And certainly we're happy to share with you more details about the data, but hopefully that can give you confidence that, the very people who may be recommending the vaccines often almost always have gotten it themselves or for their own family members.
Thank you, Dr. Pan. And a question just came in that I think is real timely. Is the shingles vaccine a once in a lifetime shot, or do we need to get it more than once?
I believe right now it's a twofer, so you get 2 shots and then you're good for the rest of your life. So now the one caveat is that if you do have immune suppression, right, and this is why you talk to your doctor, it may not be, certain vaccines may not be recommended for people who are immune suppressed because either they can cause a problem or that it won't be effective if given. But if you're otherwise, don't have an immune condition, most likely, then it's the 2 shots and you're good for the rest of your life. So, but if you do have, again, this chronic care coalition, if you do have a chronic condition, please check with your doctor. Your doctor will be assessing if that vaccine will be of personal benefit to yourself.
Yeah, thank you. And I mean, to your point, in 2014, I was running back and forth from Northern California to Southern California, working on a big project that was very stressful. And I called my doctor and I said, I think I got a spider bite on my back. It's really hurting. And they said, well, you better come in. And by then I had more spider bites on my back. And they looked at me and said, nope, 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 this is not a spider bite. You have shingles. And it grew on that nerve line. And I am now vaccinated for shingles. Like I don't want to go through that again. But it was horrible. It's so painful. And I remember my brother getting it over his head and it came down into his almost to his eye. And yeah, nothing to mess with. So thank you for that. And Janet, let me just turn to you for a sec. You've been working on, and both of you can talk about this, public policy around vaccines. And uh, you're not just national, you talk to people from all over the world. Do you have any ideas or what we could do to ensure that public policy is still going to protect people and that it will be supported?
Well, the good news is the insurance companies have made it very clear that they intend to provide coverage with $0 copays for all vaccines that were approved by FDA and authorized by the CDC effective September 2020. 25. If I'm remembering those dates correctly, I'm pretty sure. So the good news is the insurance companies understand why it's important, and candidly, probably have done a financial analysis that says to them it's a lot cheaper for us to keep people from getting sick than to take care of them when they do get sick. And so the good news is we've all the patient advocacy groups and so many of the folks that are supportive of having access to vaccines have worked with the insurance companies, and AHIP, the association representing them all, have been very clear of their support and their of people having access to vaccines, again, with $0 copay. So there's very little reason not to get the vaccine if you think it's the right decision for you or your family. And I would just say, it's like when you were talking about shingles, I will say, I have a daughter who turned whatever the age is for HPV, like the month after the HPV vaccine was approved and authorized by CDC, and I chose not to have her vaccinated at that at my pediatrician's visit. I'm sorry, Dr. Pan, but it was a month into the approval, and I just kind of wanted to see a little more data. It wasn't, and she got it the next year, but at the time, it's sort of a being, sort of, I don't know what the word would be, to be respectful of people's decision. And I think I did not appreciate my pediatrician hammering me on it, that it was not the right, that, the whole question of, was she sexually active and was all of this. And I thought, like, I know my child, I'm not worried. Let me make a decision. And so the next year, candidly, there were a lot of people that had it, and I felt confident and comfortable with it. And so she got it. Actually, both of my girls have gotten their HPV vaccines, but I feel like we now are in a place where how many people have gotten these vaccines that are out there, whether it's shingles or COVID or pneumonia, or when you look at the vast numbers of people that have gotten them and have been protected by them, either to minimize the severity of the disease or to keep them from getting it at all. It's really a little bit shocking when there are public officials that make comments without data behind it. When we see all the data, and I know, Dr. Pan, you were talking about that a little bit yesterday as well. I'd love to hear you share that to the broader community about, really why, there needs to be, you need to be able to just not say, I don't like this, or I do like this, or I make some bold statement without the factual analysis being shared with not only the medical community, but the general population as well, to defend why they were saying the things they were saying.
So, yeah, so I think one of the important things to think about, of course, we want to support each family and patient in making their individual decisions about their own health. And so that's really important. I think one of the challenges is that there's a lot of, I'm going to call it disinformation, because it's intentionally spread. There are people, including RFK Jr., who's the current health secretary, who personally have profited from spreading disinformation. In fact, the study that first claimed that vaccines cause autism, not only was it faked, but it was actually the researcher who did it was actually personally financially benefited from doing the study. He was paid by attorneys to do the study to find a particular result so they could sue the vaccine manufacturer. And then he also tried to license his own measles vaccine, which, by the way, when you wonder why our acting CDC director says we should split up the MMR vaccine when they complain kids already get too many shots, divide a current combination vaccine into three, is because that comes from the original researcher wanting to personally profit from selling his own measles vaccine. So you could see it's not about the vaccines, it's about his own pocketbook. And unfortunately, that's what drives a lot of disinformation. But when it comes to protecting the public, the decision to vaccinate is not one that only affects the individual who chose to get vaccinated or not, or the child whose parents chose not to vaccinate them or not. It affects the people around them, because for most of the diseases we vaccinate against, they are contagious, meaning that when someone has that disease, they give it to others. right? Including people who are more vulnerable. So someone with a chronic condition who's immunosuppressed, a infant. And so when we think about public policy, what do we do in our community? We need to be sure we protect the public. And that's why we have rules in schools about getting vaccinated, because it's not only a benefit to the child who gets vaccinated, it protects the other children. And those children have a right to be able to attend school safely. We have a lot of rules in schools that to ensure that we keep kids safe in school. Everything from what they can wear, because we don't want people to bring in gang symbols and so forth, to other types of rules, again, about being sure that kids are safe and can learn positive learning environment. And of course, being vaccinated is one of them, because what you don't want to do is have a child who, just because they have a chronic condition, uh, their parents do not feel safe for them to go to school because someone might infect them with chickenpox, or someone might infect them with measles or some other disease that could land them in the hospital, in the ICU, or even kill them. And so they deserve to be able to go to school safely. And I think that's something we have to keep in mind when we talk about vaccinations, because it's not just about protecting yourself, it's about protecting the community. I guess a parallel I would draw is to, for example, drinking and driving. You want to drink at home. No one's, by the way, no one's going to come to your door, and unless, hopefully you're not beating someone else at home, but when you're drunk, but basically no one's going to care what you do inside your house, as long as you don't hurt anybody. But if you get in the car and drive on a public road, that's very different, right? Because you're now endangering other people. So, and in fact, I will point out that of all the laws that I authored, not a single law mandates that a parent have to vaccinate your child. There's no one's going to come to your house. No one's going to take your child away because you didn't vaccinate your child. What we do say is what you can't do is make a decision that then puts another child at risk who's also attending that school. And that's why we have those rules. Just like the rules that says you can't wear certain things going to school because that could create a threat to other children, right? Or all the other rules school districts come up with, or the state comes up with. So, but we do want to be sure that, most importantly, people have accurate information to make a good decision about vaccination. And unfortunately, there is a lot of disinformation, and there's a lot of people who profit from this information, whether it's directly or indirectly. Social media companies have been documented to earn over $1 billion a year from vaccine disinformation. And so that's why we often don't see strong efforts to moderate disinformation. So that's something that people need to always be aware about. To what's the source of information, what's the motive of the person providing that information to you about vaccines or the diseases they prevent. Because what we don't want you to do is make a decision based on an unfounded fear or on false information about whether the disease it prevents or the vaccine itself. We want to be sure you have accurate information so that you can make the best decision for yourself and your family and for your community.
Thank you for that. I mean, I could talk about this for so long because, our personal experience, people that have received misinformation. That was one of the reasons why we did YVG. We wanted to get information out that was credible. And where do we go for credible? Then they tried to say that, like, the CDC is not credible. You don't get good information there, or you're not the science, or they're just in it for the money, or and I think. But to your point, there are companies that are making so much money over misinformation. And another personal experience is a family member. How do we talk to our family members? They don't want to talk to us out about anything anymore because they are so angry that we are proponents of getting vaccines. And on the other hand, we have an ER nurse in our family that says, well, we have a new baby, don't come over if you aren't vaccinated. So we're at both ends of that pendulum. How do we get back to the middle for people to be reasonable about getting information from multiple places, not just social media that provides so much misinformation and anger? You have dealt with, Dr. Pan, anger. You've dealt with it when you were in session. And we can't do that. We just can't do that. What are your ideas for, and this goes to both of you, for changing that paradigm to where we are able to make not make our we're not going to make our family members change, but to point them in the right direction where they can really get good information that's based on science.
Yeah. Well, and I'm and I want to take all the time, so I'm also interested in your answer, Janet. First of all, of course, we talked about your family member who said, if you're not vaccinated, you can't visit my child. I mean, parents do have a responsibility to set boundaries to keep their children safe. That's not being someone who's, not being kind to another family member. That's someone saying that I have a boundary that I want to be sure that my child is safe, and that's the role of a parent to protect their own children, right? So, I don't. I think that's important that we recognize that family members, do need to set boundaries that allow that to keep their children safe. I think that we need to accept that. In terms of the disinformation, I think it's, first of all, while the leaders, the people who put out the disinformation, personally profit from them, I have tremendous compassion for all the people who, unfortunately, have been, believe the disinformation, right? Because they're struggling to figure out, what is the right thing to do, right? Because the vast majority of people are trying to do the right thing for themselves and their family members. They want to keep their children safe. They want to be sure that that they're doing the right thing, and that's truly the disservice that the anti that this disinformation is really causing. And so, first of all, I actually take care of families who have who say that they don't want to vaccinate their children, and first step is actually listening to them and understanding the reasons why. Like, what are they concerned about? Why are they worried about the vaccines, right? So, if they say, well, I'm concerned that my child might get autism, right? Then let's talk about that. Why do you think that? Where does that come from? What is the research? What is the data that shows the association or the lack of association between vaccines and autism? There's been numerous studies that have demonstrated that vaccines are not associated with autism. In fact, I would make note that because we talked about safety and how concerned about safety, when that paper when that came out by that researcher that claimed that vaccines cause autism, the first reaction of the scientific, medical, and public health communities not to say, well, he's a fraud, right? We didn't start off by saying he's a fraud. We said, oh my God, this is something we need to look into further, right? We need to study because it was a very small study. It was like 13 kids they were looking at. It was not very, it was a very small study. It was not a very good study. Actually, if you read the original paper, for those of us who are researchers, like, this is a terrible study, right? So aside from the fact that he faked the data, we found that out later. We didn't come and say he's a fraud. Instead, people went out and said, we need to study this more. In fact, we've conducted numerous studies involving millions of children versus the original handful of children and showed that there's no association. That's how seriously your doctor, the medical community, the public health community, the scientific community takes about vaccine safety, right? Spent huge amounts of money doing the research and trying to answer the question. They looked at, do vaccines cause autism? Do siblings of children with autism, are they more at risk of autism if they get vaccinated, et cetera? On and on, millions of kids. And it turns out there's no association between the two. And that's why we can say with confidence vaccines do not cause autism, because the research has been done extensively. And so I think that's important for people to recognize that, that there's a lot of work being done to be sure your vaccines are safe. The vaccines are safe, and to ensure that the vaccines do not cause the kind of problems that oftentimes are claimed that they cause, right? And we admit when there is a problem. As I said, the rotavirus vaccine, when it first came out, there were reports of children who got bowel blockages, and those were legitimate, and there was an increased rate, and they said pull the vaccine off the market until it got fixed. And then they fixed it, and then now it's back on the market, right? That's how seriously we take it. Actually, interesting enough about the COVID vaccine is that I think the most recent story, unfortunately, the FDA, under RFK Jr., who's an anti-vaccine extremist, is trying to claim that the COVID vaccine killed 10 children. And based on unverified data, in fact, the FDA has not provided his appointee has not provided any data to actually provide the proof. But what people forgot is during COVID, one of the COVID vaccines actually showed a higher rate of blood clots. Actually, like there were only six people got blood clots, and they pulled it from the market to study it. The so-called the pro-vaccine, like, oh, everyone should get a vaccine, folks. Yes, as soon as there's a problem, we say, guess what? We need to be sure it's fixed. And we're going to pull back that vaccine. And that's what really happens. And that's what you should expect to happen. When there is real data showing there's a problem with the vaccine, it gets pulled. And until we figure out what happened. And that's why we should be confident that what we've had in the past, I'm going to say in the past, unfortunately, because under this current administration, we have people who are intentionally putting out vaccine disinformation. And unfortunately, I have to say now, the federal government is not a good source of information about vaccinations anymore. In fact, we're going to see at this upcoming meeting later this week of the Advisory Committee on Immunization Practices, they've removed all the scientists and put in handpicked people who are pointed because of their anti-vaccine points of view, and they're not going to review data and research. So what we do need to do is rely on the professionals who take care of you, the medical associations, public health associations, because they're continuing to do their work, and they've always done it. The American Academy of Pediatrics has always independently studied vaccines, independently examined them independently of the federal government. They're continuing to do that work, that those are going to be the trusted sources of information. But I want you to also be assured that the processes that we had in place before this administration ensured that we did everything we could to be sure the vaccine you received was as safe as possible, right? And that you should have confidence in that. And that's the kind of conversation we need to have with all the members of the family who have concerns. But I do say you start with listening and with compassion. Because there are people out there pushing disinformation, but many times, unfortunately, our family members who are just trying to do the right thing have, unfortunately, because they've been exposed to this, have now become fearful or anxious, and we need to address that and examine why. Why is it? Where does that come from? What does the data really show? And we need to start with compassion and with listening, because simply telling them that, oh, you're wrong is not going to work.
Right. Thank you. That was a great explanation. And Janet, do you have anything you want to add to that?
The only thing Dr. Pan covered it, which was, I was just thinking that all the medical societies, the credible medical societies out there, have all been very clear, whether it's the AMA or the AAFP, family physicians, or the nurse practitioners, or all of those medical societies are all very clear in saying that we have done a very extensive review of the data and are sharing credible and good information, allow people to make decisions. And so when you look at how it's just a groundswell of people coming up and challenging some of the threat of the misinformation, disinformation, I like your thought, because I do think it's very intended to be misleading. Unfortunately, I do. And so when you look at the real medical professionals, I would say, I don't know that I'd feel confident that I could review the data. So you count on credible scientific, experts to help you read the data and see how you should make decisions for your family. And I think they're coming out very strongly. The whole, I was trying to remember what it was called. There used to be at CDC, there was the group of experts that sat around the ones that made the decision. And it was AAFP, it was AMA, it was the cardiologists, all of those groups, and they would be there to provide insights and information to the ones making decisions. All of that's gone.
Yeah.
They don't want to hear. Dr. Pan, you've seen it.
Right.
What's happened to the whole, discussion and the debate and the review of data, and it's been eliminated. Basically, it's been eliminated, and you've been told what you should think without even the data of why you should think that way.
Yeah, this is a really good. We could stay on this subject for a long time, but a question did come in, and I think it plays into another question that I have. Someone wrote, as a 50-year-old, I received the pneumonia vaccine as a precaution, but I'm wondering if I need to get this vaccine again in the future, I'm not immunocompromised.
Dr. Pan, you could take it, or because I will just say that there have been a number of newer vaccines for pneumonia that have been approved. As the newer ones are approved, they cover a broader spectrum of, I mean,
Yeah.
I'm really out of my league here, Dr. Pan,
So
but
let me put it this way. So remember we kept talking about how important it is to have expert, trusted
yes.
people to ask about that, right? So I will say, as I was introduced, I'm a pediatrician. So I'm not quite as up to date on some of the adult vaccination recommendations. So therefore, my answer is that I don't have I want to be sure I don't spread disinformation or misinformation, right? I'm going to say misinformation because I don't want attention. So for this particular question, I would suggest that you either talk to your doctor or you can also look for recommendations that come from, again, a medical society. So the infectious disease, maybe they have something about this, or the the American County Family Physicians have vaccine recommendations, guidelines that you could look at. But I would suggest talking to a internal medicine physician or family physician or someone who takes care of patients like yourself, your own doctor, and ask them what their recommendation is for you on this and how long this particular vaccine will last. Because some vaccines will last for the rest of your life. We talked about shingles, the two vaccines. Like you're good for the rest of your life. Other ones you have to get boosters on a regular basis. So, for example, the pertussis and tetanus vaccine, basically you need to get a booster every 10 years. You got as child, and then every 10 years for the rest of your life if you want to prevent transmission of that. So in this particular case, I do not feel that I bring sufficient expertise to be able to answer that question. And so I want to direct you to someone who who can provide you that answer.
Great. I want to get into two things. I know we're running quickly out of time. An hour just is such a short amount of time. But I've got a couple of questions. We were talking yesterday about mRNA
Ah,
and how that works, and that some very interesting discussions about its shedding. And you answered that. And Janet, being in the work that you're doing, I think both of you could respond to that. What is the mRNA and why is it safe?
so first of all, I don't know if people remember their high school biology, but mRNA stands for messenger RNA. So if you recall, there's something called DNA, right? They call it the blueprint of life, right? That's in the nucleus of your cells. That's the master blueprint for your cells in your body. Okay, it's in that DNA, right? And that's why and so people look at DNA and they look at like what kind of genes you have. Now, what happens is, so that's the major blueprint. Now, what happens, your cell takes that DNA, right? And they take that code and they have to translate that code into proteins because the proteins are the things that actually do the things that the DNA codes for, right? So how does it go from DNA to protein? Well, actually, first of all, DNA is the master blueprint. It stays in the nucleus where it can be safely protected, right? And then, so what happens is that your body takes the DNA, which is the master blueprint, makes a copy of it. That's called mRNA, or messenger RNA. Why is it called a messenger RNA? Well, what happens is it makes a copy. That copy goes from the nucleus out to the factory of the cell called the ribosomes, which makes the proteins, takes that blueprint, right, and it sends a copy out to the ribosome where basically it generates the protein. All right. And then the protein, of course, causes different things to happen, really important things to make your cells work, including, by the way, things that might cause your cells to become, cancerous or to do other bad things too, but also usually good things. So just keep in mind that's what mRNA is. And so it's a powerful tool if you can actually affect the mRNA to actually address certain diseases, including things like cancer, without actually trying to tinker with the master blueprint, the DNA itself, which is, which you really don't want to mess up. Okay. So because of that, it turns out, well, let's think about COVID or other flu. By the way, they're looking at mRNA vaccine for flu, which actually has turned out to be very promising. And as well as what they're doing is like, well, you take a virus. A virus essentially is a piece of DNA or RNA surrounded by a bunch of proteins, right? And those proteins are the things that cause the virus to be very infectious and cause you to and oftentimes what makes you sick. And so what happens is that you can actually give a vaccine that only produces parts of the virus, so you don't actually get sick from the virus, but still train your immune system to recognize the virus and kill it. Okay, so that's and so using mRNA actually harnesses your very own natural protein building system in your own body to help to help your body respond. And so they turned this mRNA thing into something scary, right? By the way, everybody has mRNA. Not everybody, every living thing has mRNA, right? So when they say we want to ban mRNA, well, by the way, your entire body actually produces large amounts of mRNA every day, every second. Otherwise, you'd be dead if they weren't producing it. That's what's keeping you alive, right? It's that constant generation, et cetera. But what happens is the disinformation is that they're trying to scare people about mRNA. We should ban mRNA, except that's what keeps you alive. And if it sheds, well, by the way, your pets have mRNA, your kids have mRNA, your parents have mRNA, your trees have mRNA, your grass has mRNA, everything has all the living things have mRNA. That are that basically maybe beyond like certain bacteria or something. But anyway, so let's not those folks who try to drive us away with fear from something that we may not be familiar with. You should be talking to people like, so what is mRNA? Why should I be scared of it? Right? You should be asking those questions. What does it normally do? Right? Because they often try to take something that's normal and say, oh, it's scary. But actually, mRNA is what makes life work. And that's what makes it so powerful, but it's also so natural. So why should we be afraid of it? And it has such potential to not only stop, infectious diseases, but also stop cancer. And so why are we stopping research? They've defunded research on mRNA, but that's stopping cures for cancer. And that's why we shouldn't be afraid. We should be understanding.
Janet, did you want to add to that? Because
I just wanted to say that on the CVEEP's website, there is a white paper on what is mRNA. And it says all of what you've just said, Dr. Pan. But if somebody wanted to go to that site, there is a piece, because it is so confused in so many people's minds. When you hear people saying they're not allowed to give blood if you've had a COVID vaccine, like, what? I don't know if you've heard that, but we've heard that at many places around the country. And it's just such an amount of disinformation. So thank you. That was really helpful.
Yeah.
So I know
we got 2 minutes, Liz.
I know we have 2 minutes. So the last question is then, how do we as advocates, parents, patients, advocate for continued use to support the use of vaccines?
Well, I think one of the most important things is to share with people why we got vaccinated in the first place, right? How each of us made our own personal decision to get vaccinated so that we can guide other people in making that decision. And that's why I opened up by sharing the fact that I've gotten my recommended vaccines and I've gotten my children vaccinated as recommended on the schedule as recommended. Now, I'm not being paid to do that. Right? I'm doing it because it's the right thing for my family. Any more than I say that anyone else hopefully is not being paid to do the right thing for their own kids, right? Because they like to say, oh, well, it's because of, big pharma or something like that. No, this is about doing the right thing for your children. We want to support you in making your own personal decisions for yourself and your family. And hopefully by also seeing how other people have made that decision and the reasons they've made that decision, they'll help you in making your own personal decision. But I think for each of us who have gone through that process of making that decision, to share that with others is one way we can help build people's confidence about doing the right thing, which is frankly to get your child vaccinated. It is what it will keep your children the safest and make it less likely for them to get ill, and also for each of us, for ourselves as well. As I mentioned, shingles vaccine not only does it stop shingles, it also reduces the rates of Alzheimer's. Hey, that sounds pretty good to me, right?
Well, I want to thank you both so much for all your insights and expertise in this. I'm going to just I have this last slide out so where people can um, see where they can get in touch with us. Like I said, we have recorded this. We'll get it out to a large group. Um, Janet and Dr. Pan, feel free to share it any way you want. If you want us to get it out on different social, we can send it out also and tag whatever you guys do. But this is certainly a discussion that's going to continue for a long time. There's no end to it at the moment, but we've got to make it better. We've got to ensure that we can do this right. So thank you both, especially coming in during the holiday season. We know how busy you are. Janet, you have your big party tomorrow, and you came in today to share your time with us. And Dr. Pan, we know you're super busy. You're running for Congress. I mean, oh my gosh. So have a wonderful holiday. Thank you, everyone, for joining us. And we look forward to seeing you again soon.
Thank you all.
Thank you. Have a safe holiday.
Thank you.